Hi, I'm Dr. William Song from Omni Aesthetics in Oakland, New Jersey. Today, we're going to talk about Botox, or botulinum toxin. There are actually 3 different products that are available in the United States that are FDA approved. We have Botox, Dysport, and Xeomin. They're essentially the same thing. They're all botulinum toxin. Botox is one of the most common treatments that I perform in my office, and worldwide it is probably one of the most popular cosmetic treatments. So Botox was approved by the FDA for use in cosmetic use in 2002 in the United States. So it's been used by millions of people all over the world very safely, and the typical person who would come in for a Botox treatment would typically be a woman in their 40s and 50s. But we have people coming in all age groups, and even older women come in for this treatment. And it is very rapidly becoming a very popular treatment among men. Now, the reason that people do want to do this is, quite frankly, in this age, looks do matter, and youthful looks, matter a lot when you're looking for a job, especially if you're in the media. So, just to keep that competitive edge, Botox is a very effective treatment, and it's a very safe treatment that someone can get with no downtime or very minimal downtime. Common areas that we treat are the frown lines here, often called the number 11s. Now some people will have a number 1 or number 3 or 3 lines, and that's going to vary because everybody has a slightly different muscle structure, and that's going to determine what the shape of the lines, the frown lines that are being made. So when we treat it, we have to look at where the muscle is to make sure we treat the proper injection points. And when treated correctly, we should have a nice smoothing of the skin, because the muscle is not causing the skin to scrunch anymore. The way, again, that it works is that it weakens the muscles. So any muscle that we don't use, the muscles will shrink. So if you continue with the treatments regularly, we find that the muscles do tend to shrink a little bit, and we find that we can spread out the timing in between treatments a little more if you're getting it regularly. Often people will ask me which product lasts the longest. I have the most experience with Botox and Dysport, not so much with Xeomin, but I've found that Botox and Dysport are very similar. And in fact, some people might find that Botox lasts longer on them, while another person might find that Dysport lasts longer on them. So in general, I think it's about the same as long as the conversion is correct. The other question that I'm asked a lot is, how long does Botox last? So typically Botox and Dysport will last about 3 to 4 months. Now this is going to vary for different people. Some people who metabolize very quickly may find that the effects wear off faster. So Botox is botulinum toxin. Now botulinum toxin is the same substance that is found in botulism food poisoning. When you get botulism from food poisoning, it's dangerous because the botulism will weaken all the muscles in your body, in which case you wouldn't be able to use your breathing muscles, and that's what makes it dangerous. When we use botulinum toxin for cosmetic use, like with Botox, we're using such a small dose, it's such a small amount, that there's never been a case of any kind of serious side effects from using cosmetic Botox or Dysport or Xeomin. Realistically, the things that could happen is you can get some bruising. Anytime you use a needle, you could get a little bruising, or you can get some swelling. Very rarely you can get some significant bruising, but usually with Botox the bruising is minimal. The other thing that could happen is sometimes you can get some unevenness or drooping, and that typically happens when you use a little bit too much, or when somebody's very sensitive to it. And the typical area where you see the drooping is in the brow. Okay, if we weaken this muscle too much, you can get some drooping. And this is very temporary, and it will resolve. And often there are some things that we can do to counteract that. But that is probably the most serious thing that could happen with this. But again, it is a temporary thing. There is absolutely no long-term effects from that. But you would be very surprised at who's getting Botox treatments. You may not even, if it's done correctly, you may never know that somebody is getting Botox. It could be your school teacher, your neighbor, somebody in your church. But once you get the treatment and they know that you got it, they won't stop talking about it, because people just love it. And I will say that it is a little bit addicting, because it it does make you look so much better, and it makes you feel better. So we do caution people not to go overboard.